proceed. Thank you.
All right, thank you so much. My name is Caitlin Frumerie, and I am the Executive Director of the Rhode Island Coalition to End Homelessness. I'm going to be doing a presentation for you folks today on homelessness in Rhode Island with some updated numbers as of the calendar year that just closed, as well as sharing some insights of what I think solutions are. I also think it's really important when we talk about homelessness to make sure we're including people who have actually experienced it. So I do have a guest with me, Wendy Thomas, who will be speaking towards the end of my presentation to just share her personal story of experiencing homelessness, because I think when we're talking and doing this work, we should be centering and uplifting the voices of the people that are actually impacted by our work. So hopefully it'll be an informative presentation, and my understanding is questions are at the end, so feel free to ask whatever you'd like. There are several slides in the deck. I will not be actually reviewing each of them here. I wanted to give everybody a sense of what the data was. They can look at it at their leisure. They can ask questions, but given the time frame, I wanted to make sure you had it, but I'm going to cover the highlights in the presentation.
And if I may, on the issue of questions, this commission does tend to ask questions on the way, so if you don't mind.
I'm happy to do that.
Okay, so commissioners, feel free just to raise your hand if you have a question.
All right.
We can also do them at the end as well. Thank you.
All right, perfect. All right, so I always like to start with why homelessness occurs, and not just simply dive into the numbers about who and what homelessness looks like. And really, homelessness exists because of the lack of housing. So there's a mismatch between what people can afford and what is available. So income does not meet cost. So an average two-bedroom in Rhode Island is just over $1,700. You would need an income of $70,000 a year to afford that. I think we can assume a lot of individuals in Rhode Island are not making that income. So you would need to work roughly just shy of 80 hours to afford that two-bedroom at fair market, and that is at minimum wage. And then when we look at what renters make, it's about $18 an hour, and this is all coming from the Housing Works Factbook, so thank you very much to them for their leadership in this area. And so that's what an average renter is making per hour, and then when we look at what the housing wage would be, it's $34. So there's a big gap there of about $12 per hour of what people need to make to afford that two-bedroom. And then when we look at people experiencing homelessness, what we find is that that income is even drastically lower. So this is those that are residing in shelter or transitional housing at entry. We have about 46% of them that have no income to begin with, and then another 25% that make between $6,000 and $12,000 a year. This is including our entire system, so families, individuals, couples, and I just want all of you to imagine, I'm sure we all have budgets here, making that budget work on $8,000 a year. You know, there's only so much magic you can do with the numbers to meet your basic needs when you're making such a low income. And then when we look at people who are residing outside, we see, you know, the same scenario. We have a roughly 43% with no income, and we see another just shy of 23% that have between $6,000 and $12,000 a year. And what we've seen over the course of the pandemic is that the numbers at the extremely low income kind of levels are growing. So we've seen a decline in income, both no income and then some income. And the other piece I want to remind here is that people do have some sort of income. If we look at this, the majority have some. So I do want to dispel that myth sometimes that people experiencing homelessness aren't working or are not kind of contributing to society. Again, a lot of it's a mismatch between what they can make and what they can realistically afford. So this is what, when we talk about that $8,000 budget that I'll have you crunching in your heads, this is what your rent would need to be in order to make that realistically work. And I have yet to find an apartment in Rhode Island for $200. I don't even think you could probably find a roommate at that rate. So what we're really seeing is that there's just not enough affordable housing. So now I'm going to talk a little bit about trends in homelessness. We have shown on the screen here the point in time count, and a point in time count is really just a fancy way of saying census for kind of one evening. We just finished our point in time count for 2023, and I thank you to those of you in this room, Secretary Pryor included, that volunteered for that. We'll have the data from that closer to the spring. So we're currently tabulating and deduplicating. There's a lot that goes into making that happen. But you can see the point in time count that we had last year was roughly 1,500 people. And that's on one night. And that 248 people living outdoors is a dramatic increase from what it was kind of pre-COVID times. You know, I remember 5-6 years ago, that number would be closer to 70, 75. So we've really seen those living outside dramatically increase. And this slide I'm not going to talk about again because some of this is here for you to look at, but it just gives you a sense of what the data has been over time, and we're certainly seeing that uptick. This slide is just giving you a sense of homelessness right in this minute. So we have a little over 1,100 people in shelter right now, and then we have roughly little over 375 people living outside, which is roughly 1,500 people. So we're continuing to see homelessness either increase or stay the same. One thing to note here is this is reflective of what's in our database, which does not include the domestic violence providers. They're in a separate database. So this is actually a higher number than what you saw in the point in time count, and that number included the domestic violence providers. So we're seeing certainly the situation remain dire. One piece I wanted to briefly talk about was, okay, we have people experiencing homelessness, but how are we supporting those? So this is just a chart that's a little bit hard to read, but hopefully those of you that have it in front of you can see what are the trends of the stock of resources that we have. So we, in trying to end homelessness, will look at emergency housing, transitional shelter. Rapid rehousing is another way of saying rental assistance for those that are currently experiencing homelessness with services. And then permanent supportive housing is a little bit like an assisted living or a nursing home. So if you think about our people that are most vulnerable, most in need, that are going to need services and a lot of subsidy, permanent supportive housing is the silver bullet for that population in terms of helping them. And that tends to be for individuals who are chronically homeless. So this is a sense of, in our emergency system, roughly the number of beds that we have. And you can see by population and by couple how they're broken out. And we have seen an increase in the number of seasonal and overflow beds. I think the state for that contribution. But as you'll hear me talk about, we still have a mismatch between both supply and demand on the housing side and supply and demand on the shelter side. And one thing I'll say, people are staying longer in shelter. So theoretically, you could serve a lot more people through our current homeless system if we were able to quickly move people into housing. So theoretically, you wouldn't necessarily need to add any shelter beds if we could get everybody that was in the system housed. Now, that is a much longer term solution in terms of what needs to be in place. But when we think about this commission and what it can do, it's about housing, and we don't want people in shelter on the street. We want them housed. So really, it's wrapping around this challenge from a number of angles. And I also just wanted to give a little bit of a preview of where the money typically comes from when addressing homelessness. I'm not going to detail this out. You can read this at your leisure later. But we typically see money coming in from federal and state resources. And we have a number of partners that are kind of working together for that. So you can see there's the continuum of care. That is the major funding source to end homelessness in Rhode Island, but they cannot typically fund shelter. That's usually left to the Emergency Solutions Grant and state money. And then this slide just highlights the work of the Consolidated Homeless Fund under the Department of Housing. And that's typically funded under the real estate conveyance tax. Additionally, there are certainly ARPA money and other resources in the budget, but I can let the leadership from the housing talk more about that. So this is just giving a sense of how unsheltered homelessness changes over time. You can see that we have peaks and valleys throughout the year. This is comparing 2022 to 2021. So these are individuals that have shared that within the last 2 weeks that they're outdoors, and that is either to a street outreach worker or to the help center that the coalition operates. And one thing I wanted to make sure to kind of talk about when referring to unsheltered homelessness is a couple of, not necessarily myths, but helping add context. So generally, people don't want to live outside. If they had access to affordable housing, they would take that. Unsheltered homelessness is really dynamic and ever-changing. You know, you might be able to stay in a tent or in your car briefly, and then that becomes no longer an option, and so you move inside, and then maybe you switch locations. So it's something where it really is evolving, but the data that we have on people experiencing homelessness comes from firsthand accounts and street outreach workers. So we have someone calling and saying, hey, I'm unsheltered, this is what's going on. An outreach worker is in the moment, in situ, talking to the individual. And all of that information is tracked in HMIS, which is our database that governs the homeless system in Rhode Island. We focus in that database on understanding persons experience homelessness and not necessarily encampments. And that's because of the nature of homelessness. If I have someone that's sleeping outside, I have an available bed or resource to give them, it's much more helpful for me to have their name and their information to be able to call them and get them quickly into housing, rather than like a location which can change over time. So the focus is really on the people and not necessarily tracking encampment data. So that's not something that's in the database. And lastly, I just wanted to make sure that people understood, you know, the data is accurate, we keep it secure, we maintain confidentiality. And then the last thing I think it's helpful to specify, and I am not an attorney, I'm just a social worker, but when you are experiencing homelessness, that in and of itself is not enough to warrant removal or, you know, an allegation of abuse and neglect under Rhode Island state law for the Department of Children and Families. Where that occurs is where there's other circumstances of abuse and neglect, or someone has the opportunity to be in housing or shelter or some other place and is choosing not to. So that's the area where abuse and neglect comes in. So I think I want to make it clear for families that may be experiencing homelessness that they don't need to hide, that they really should be coming forward and sharing their needs with the help center providers, that they are protected under Rhode Island law, provided that there isn't other abuse or neglect occurring. So I think that's a little bit of a myth bust that we have sometimes with families, particularly those experiencing domestic violence, where they just won't reach out for fear their kids are going to be taken away. And that doesn't help us understand the problem or help that family. All right, so the next couple slides are just talking a little bit more about our help center. I've referred to that a couple of different times. I'm not going to go into a ton of detail. You can look at this as you'd like. But I did want to just specify a little bit about the process. So when someone experiences homelessness, they present to the coordinated entry system, also known as a help center. They may be diverted and referred to another resource in that moment, or they may be assessed for shelter or services, and then the goal ultimately is connect them to whatever resource there is. The challenge that I have as someone who oversees the system is that there just isn't enough resources. So it's a little like running a 911 dispatch when I don't have enough fire trucks and police to send out. And so what that results in often is really people waiting for resources. So, you know, as of last week, we have 174 adults, 31 families, 64 families with children that are generally residing outdoors and looking for housing. And then this gives you a little bit of a understanding of the mismatch between supply and demand. This is just looking at people who are unsheltered, so this is not everybody waiting for shelter, you know, that may be doubled up. I wanted to focus in really on those that are outside. So for instance, you know, recently we had, let's say, 274 people outside. Maybe that week or month I was able to make 23 referrals. So you can see there's a pretty big gap between who's presenting and saying, hey, I need help, and the shelter or resource we can send people to. And it's the same gap, smaller with families. And, you know, when we think about homelessness, it's helpful to understand where people are coming from. You know, usually you don't just become homeless overnight. There's a long process. There's an eviction, there's disruption with family, there's domestic violence, and Rhode Islanders are really good at troubleshooting and problem solving. A lot of what you and I would think about if we lost our housing today, we'd immediately go into, okay, how do I figure this out? So a lot of individuals before they come in have tried other resources, and they're just really at their wit's end. There isn't other family, there isn't other support. And one of the things I think we can do, I'll preview a solution that I address later on, is how can we better help prevent and support those families and individuals in problem solving to avoid them getting to the point that they're living outside. Because you can intervene earlier, usually in some pretty kind of less intense ways than you need to once they actually lose everything. And I've just mentioned shelter stays are longer, which is clogging the system up. I also wanted to highlight what exits look like from the different projects we have. Those that are in the blue tend to be more positive destinations. The gray tend to be more unknown or negative. So we really do see that, you know, rental assistance, housing, all result in outcomes that have people in housing. So what we need to do is make sure that we're having those housing options for people to go to. And I'm not really going to talk much about the demographics. I think a lot of this is here for you to review. But I do just want to highlight one really heavy data point. People experiencing homelessness usually die on average about 20 years sooner than the rest of the population. So that tends to be between 45 and 55 years. So just the feeling and experience and the trauma of homelessness results in a reduced lifespan. And so when we think about, you know, the elderly population or the aging population or the disabled population, you know, keeping in mind that, you know, a lot of them we don't have anymore, and we could have intervened sooner, but, you know, people really do experience in a medical health well-being way the impact of homelessness in a just drastic way. And I'll also just highlight that we see really upsetting, disproportionate BIPOC representation in people experiencing homelessness. The one that troubles me the most usually is our families that are unsheltered. So for instance, Black persons make up roughly 8% of the population, but they're about a third of the families living in shelter. And they're about 40%, well, this is actually Latinx. In any case, they represent Black families, 8% of the state, 30% of families living in shelter. So that is just a representation of how our systemic racism, the way that resources are allocated, the lack of income, that really looking at this through a DEI lens is really imperative. And it's similar when we look at the Hispanic or Latinx population, again, only 17% of the state, but make up roughly 40% of the families living in our shelters. And as I mentioned, I wanted to make sure we were including and lifting up the voices of those that have lived what only I have seen. So Wendy, I would love for you to share your story and introduce yourself. This is Wendy Thomas. She is a gifted speaker of our Voices of Homelessness program. And if any of you are interested in having a speaker come and present to an event or training that you have, we make them available. We do compensate our speakers, so we will ask for an honorarium, as it's only fitting to pay people for their expertise. But Wendy, we'd love to hear your story.
Good afternoon, everybody, and thank you for having us. I always start my story out with a question. How many of you know someone who has lost their housing due to a fire? Because that's what happened to my family. quite a number of years ago now, I did now, when my kids were teens. I was at my mother's house so the kids could go to a Halloween party at the YMCA overnight. I was helping take care of my mother on the weekends when I wasn't working. I was working at the time. Get a call on Saturday morning, your house is on fire. Can hear the sirens and everything in the background. It's scary, really scary. So, needless to say, I got a ride up there, tried to get some situations taken care of. Got us into a hotel for 3 days, which is pretty much all that the Red Cross pays for. Proceeded to go to Travel's Aid at that point, which is Crossroads now. They worked it out so that we got into a shelter. Was in the shelter for about 2 months. Luckily for my kids had been in daycare and in school, so I talked to the schools and the daycare and let them know what's going on. Took a week out of work to try to get things straightened out. And the week I went back to work, I heard from one of my neighbors that one of the other neighbors had an apartment that was available. All I had to do was come up with first month's rent and deposit. So I did. It took about 2 months. Excuse me. So we moved in there, and we were in there for roughly about 4 years. And then I moved to Central Falls only because it was closer to my ride to work. And we woke up on a Saturday morning, here we go again, another fire. Actually, it wasn't even a fire, it was a ballast that blew in the basement, filled the house with smoke, they condemned the house, shut the electric off, the whole 9 yards, had to go back to shelter. By this time, my kids were 17, 18 years old, my younger two. I had a grandson and a granddaughter at that point. My granddaughter was 9 months, my grandson was 8 months. They were a month and a day apart. So we went into the motel room, but this time, the way the shelter system is set up, the family shelter would not take all of us. They would take both of the girls with the babies, which my youngest daughter went to. My oldest daughter did not go to. She had already been through some college, so she went down and stayed with friends that she had gone to college with. My son, however, was in a different situation because of his age. At that point, family shelters did not take a boy, over the age of 14, that they suggested they go to either to a men's shelter or stay with friends. So that's what my son ended up doing. Thank God we were like one of the places in the neighborhood where all the kids hung out. So that's what one of my son's friends' family let him stay with them for a while. And then he went down and stayed with my sister in Connecticut. So we worked at it, and you gotta remember, back then, cell phones were not by the month, they were by the minute. So needless to say, I was the only one working. I couldn't afford to keep cell phones for all of us and plus save up money for a 3 or 4 bedroom apartment for all of us with the little ones. And it pretty much broke the family up because we didn't have the communication that we used to have. At this point now, I have communication with my twins, both of my twins. My daughter, who has 3 kids, my son has 1, and my oldest daughter has 5 or 6. She's in Connecticut, and we really don't hear from her at all. After we got places to stay, I was still working and worked on getting a place to stay for all of us. That didn't work out too well. My daughter ended up going to share an apartment with one of her friends that she met at the shelter, which made it a little easier for me and to get into something on my own. But then I got ill. and my health deteriorated quite a bit. I went back to Crossroads. I took the nursing, okay, I can't even think straight today. The nurse's aid course while I was there. Graduated from that, was out ready to try to find a job, and my health deteriorated even worse. I was having a hard time walking. Went to many doctors, went to many appointments, went to physical therapy, the whole 9 yards. Found out that once they finally got me to the right doctor and did the right x-rays, that I had to have a hip replacement at 52 years old, which was not an easy task because they don't like to do them at that age, because they don't like have to replace them. But when they ended up scheduling me for the surgery, they had just come out with one that was guaranteed at least for 10 to 15 years. So I went to all the preoperative testing. During the preoperative testing, we found out that I already had one heart attack. Not fun. So I had to go through a whole bunch more testing and a whole bunch of other stuff just to get the surgery. Finally got the surgery and was back up on my feet I had the surgery in August, was up back on my feet and doing what I could. By December, was starting to look for places to work, etc. Ended up it was either January or February, had another heart attack. Fast forward to the next August, had a third heart attack. It wasn't pretty. Ended up back in the shelter again. Have been in a couple of first step programs, which kept me settled for some point in time. Ended up getting into permanent supportive housing. Was there for 4.5 years. And now I am grateful to say that I worked myself out of permanent supportive housing and have gotten myself into a senior complex Section 8 building. So what I'm trying to say basically is housing is needed. People can get out of homeless. People can work out of homeless. I worked myself out of it. It took a while. It took a very long time. But I got there. There's a good 30 to 40% of the homeless you don't even see in the streets because they're in the background trying to work themselves out of it. And that's where I was. Thank you.
Thank you, Wendy, so much for that.
Wendy, thank you for sharing your story. I don't know what to say, though. It's a long journey and through so many different layers of the system. It gives us a lot to think about, so appreciate that. Leader Chippendale, you have questions?
I do. Thank you, Madam Chair. And thank you for that story, Wendy. That was very compelling. To Caitlin, you certainly provided us with a lot of figures, and that's appreciated. A couple of populations I'm curious about, and they may be included in your figures, but not broken out. So pre-homelessness, there's the whole couch surfing dynamic. And I think that's probably the last gasp for that individual before they become homeless. So are those numbers of couch surfers represented in any of the figures you presented, or you weren't able to capture them because of the difference?
So what I've typically focused on is those residing in shelter or those that are unsheltered, just because the crisis is so overwhelming. But we do have a little bit of a beat on those that are doubled up just because we operate the help center. So we have, at any given point, over 1,000 persons waiting for shelter. And my numbers are showing only 200-ish, maybe a little bit more, are actually unsheltered. So that other 750 are in other situations. They're doubled up, they're facing eviction, and that's an undercount. Because I also kind of touched on, some people may be afraid to reach out for fear of their children being removed or the stigma that comes along with it. So while the doubled up numbers that we may see are in the hundreds. I mean, it's in the thousands if I had to guess. And there's a spectrum there. There's people who are doubled up in a way that may be maintainable for some period of time, and then there are people who are doubled up in subsidized housing where if they stay there more than 2 weeks, they're going to get kicked out.
Sure. And then another population, which I suspect you don't have because this would be exceptionally difficult to capture, the at-risk folks, the folks who we see their fourth generational home being lost to a tax sale because they just simply on Social Security can't afford to pay the property taxes. And I believe that there is a significant number of folks who find themselves right on that cusp where they will soon be in, unfortunately, that stream of unhoused or folks who will be seeking affordable units, you know. It's something that, again, we've seen as a legislature, we have addressed some of the tax sale issues, but I think that an ounce of prevention is worth a pound of cure, right? When you're doing triage, the first thing you do is you stop the bleeding. So these two populations are going to be mainlining right into your numbers, and I think there are things that we can do.
Well, and I was going to say, so I think between us and 211, we got it.
I'm interested in hearing it.
Yeah, so to your point, Leader Chippendale, you're absolutely right. And 211, we just announced last year we took 81,000 phone calls for housing. So we tend to be the entry point to which folks will come to look at what resources may or may not be available. So they've identified there's a crisis, coming. Where are there, what tools in the toolbox can be used? We do get folks that are also couch surfing in that realm. We do forward them over to the coordinated entry system so that they can determine. Sometimes folks don't want to be in the system either, and so they say, no, not yet, we'll come back to you. But we are taking those kind of pre-risk or one crisis away folks through the 211 system.
Thank you very much. Thank you, Madam Chair.
Other questions? Yes, please, Jen.
Thank you for the presentation, Caitlin. Just curious if you could talk a little bit about the different categorizations of homeless. So I understand there's category 1, which is literally homeless, and category 2, which is you're at imminent risk of homelessness. So looking at the data, just like on slide, I think it's 22, or maybe it's not that slide, there's a different data point you can share. What percentage of the individuals who are, I think the term you said is announcing as homeless would fall into those two categories? And then secondly, my understanding is that after there's a universal assessment done, right, the SPDAT, then the vulnerability of a person or a household is rated in high, medium, and low. Could you also give us a snapshot of the proportion of individuals who are presenting as homeless, that's the term you use, in those three categories? Because my understanding is that the highest acuity are the ones who need permanent supportive housing. And so as we're thinking as a body here of what the types of housing solutions we want to develop, it would be good to just have that more nuance. So if you could just share category 1, category 2, and low, medium, high, that would be great. And thank you very much for sharing your story. And I'm grateful for that. I do believe that now the family shelters do take
They do.
children
yeah.
over
If
18. I
they're
just want to make
funded.
sure everyone knows that that's no longer the case, that you can bring a little boy up to 18 now in family shelters. But I'm so sorry that was not the case when you were there. That's horrible. Thank you.
So to answer the questions first, her reference to categories is a HUD definition. So if we want to get nerdy and talk about it, and where the HUD definition matters is it's typically related to funding and eligibility. So you're correct that there are 4 categories. The majority of this presentation, I've tried to actually reference the location of where people are living so that it kind of dispels that and we don't get into the weeds of the HUD definition. So in general, who I'm referring to are that first category of homelessness that are people who are sheltered or unsheltered or experiencing domestic violence. So that's the majority of who's here. When you will see slides about how many calls that we're getting, that tends to be focused on the larger number because we have, as 211, we have everybody calling. But even the mismatch, like I've tried to say, okay, this is actually unsheltered so that it's a little bit clearer because it does get confusing as mud when you bring the HUD definition in. Is that an answer to the first one? Is there any follow-up on that?
No, I think that's fine. So when someone calls and there's the first assessment that takes place for your person.
Could you put your mic on, please? Sorry.
So when someone calls the help center and there's the initial kind of assessment that's done, and I know that's a kind of a quick and dirty assessment, if you will, it's not the full vulnerability assessment. At that moment that you're able to kind of parse out individuals who are quote unquote literally homeless versus those who are at imminent risk of homelessness. And so the data that you're presenting is parsed out in that way, or are those generally translated?
Yes, so each of the slides should be labeled with the population that's there, so I'm happy to talk offline. When the help center, so we get calls, right?
Yep.
We do, as you said, assess based on vulnerability, and really the risk assessment at its core tries to house those that are most likely to die in the streets first. So those that are elderly, those that have health conditions, those that may have young children. So it's dynamic, but that's the goal. We're actually currently, the continuum of care is working on updating it. So what we do is we have people waiting for shelter that are doubled up. We have people waiting for shelter that are in other housing situations besides unsheltered. So that list of who's waiting for shelter is usually a little over 1,000 at any given time. And then that gets, of that 1,000, there's roughly about a quarter that are actually unsheltered. And the prioritization process, because if we think about who's most likely to die outside, it's the person that's outside. So then we're focusing in on that number. When we look at point in time count census data, that is exclusively people who are outside or in shelter. So that's kind of where we've labeled it. In terms of how the vulnerability kind of high, medium, low risk breaks out, I mean, it's almost a little bit like a bell curve. We tend to have a bell curve with a slightly higher one side when we talk about people who are high need. So we usually have that middle bucket that's the largest. I can get more like specific numbers. I don't have them memorized off the top of my head just because it is dynamic. But, you know, our lowest number currently tends to be the lowest risk. We have a pretty decent chunk in the middle. And then we have, you know, another chunk of those that are high need. And what I'll say about that high need population is they didn't start out that way. The experience and length of time they're experiencing homelessness has allowed them to become chronically homeless and high need, right? We heard the story from Wendy where, you know, her health condition was really directly impacted by the trauma of homelessness. So I do think having worked in other states, some of the communities that have kind of right-sized their system tend to have a more consistent bell curve in terms of, you know, it's the middle that tends to be the most, but we're having more people kind of age into high vulnerable chronicity. I'd also say just largely on what contributes to people's homelessness, it certainly is the housing mismatch, but there's other systems in play, foster care, corrections, racism, so it's complicated, right? But usually, you know, show me someone who experienced homelessness, I'll show you a system that's failed them, right? Like if we better supported victims of fires, you know, maybe Wendy wouldn't have the story that she did. So it really is a cross-the-board problem that needs cross-the-board empowerment and contributions to make solutions.
Thank you.
Yes, Scott, please.
First, thanks very much for compelling presentations. A very important and devilishly complicated problem in many ways.
It is, yeah.
A couple of questions. And this, I may be perpetuating an urban legend with this first question. And I hope I'm not. I hate urban legends.
All right.
But just from conversations I've had with some homeless people, while I agree with you that it doesn't seem like anybody wants to live outside, I do have a perception that some people who are living outside don't want to be in a shelter. And what's your take on that? Is that accurate? Is that a large portion of the people who are living outside, or a very small slice?
Right.
Is there anything we can do about that?
Well, you kind of answered the question a little bit. We're talking about how it's complicated. So my answer is going to be complicated, right? So shelter, what does that mean? What does shelter look like, right? So there's a difference.
And by the way, I'm not sure I'd want to live in a shelter.
Right,
I don't
right,
know what's
right. Well, and I
what-
guess I mean to say, when the devil's in the details, because when you're offering someone a resource, it's got to meet their needs, and everybody has unique needs, right? So there may be some individuals that say, well, I have a pet and my wife, and in order to go into shelter, I'm going to need to get rid of one or both of them. So I would rather stay.
This is a critical question on Valentine's
This is
Day,
what I'm
right?
saying. Because we have a lack of couple spaces. So you bring the pet. I'm not going to get into decision making, but just like each of us has had unique needs when we've looked for our own housing or other solutions to problems we've had, it's the same people. It's the same thing for people outside. So yeah, there are some of them that don't want to go into specific shelters, or maybe don't want to go into specific shelters in certain parts of the state. If your kids are going to school in Woonsocket and the shelter you're offered is in Newport, how early are you going to have to get up to get those kids out? What is that going to do to their day? Because they're going to get bused from Newport to Woonsocket. So there
What about
are
basic
decisions
safety
that come in.
concerns? Aren't there also basic safety concerns people have about being in a shelter, that they're going to be abused, molested, robbed, those kinds of things?
So is there a question there? Sorry, I want to make sure.
Well, the question is are those real concerns out there on the streets, and are they legitimate concerns, or are the shelters pretty safe places?
Yeah, I mean, I can't speak to what the experience of other people have in shelters. I mean, I think our service providers do a tremendous job in working to keep them safe, to provide services. Are facilities perfect? No, nobody's perfect.
Right.
But I think the majority of our partners would say, we don't want to shelter people, we want to house people, right? It's a game that no one wants to be in. We want to house, but there just isn't enough, and shelters are certainly a way to keep people off the street. But I think each Rhode Islander's got different needs, and we need to, I think of it a little bit, going back to the toolbox that Courtney had mentioned. We want to have a toolbox with a variety of tools, because you can't use an Allen wrench for everything. So that's where you're going to have different types of shelters. Maybe it's temporary assistance. Maybe if you're intervening sooner, getting people out faster, we're relying less on the shelter system because we're able to help in these other ways. But what we really need is, the resources, the leadership to do that, and make sure that we have that pipeline of affordable housing that we're moving towards. And one piece I want to highlight, we've talked a lot about housing for different subsets of the population, but when we're talking about ending homelessness, it is extremely low-income individuals. So we need to be providing subsidies and rental assistance and whatever else, because you've got to really invest at those at a higher rate than you would just a general housing unit, because somebody that's making $6,000 a year isn't able to contribute the same rent that a renter that's making, 20, 25. And the last thing I'll say, I'm so grateful for the leadership of the Department of Housing and Secretary Pryor, and we just need to make sure that we're supporting them with their capacity to kind of help us make this happen. And I still continue to think that an interagency council on homelessness would be helpful. It takes all of the people to work together to bring the solutions, and it can't just sit with Department of Housing. It really has to sit with everybody, because it's all a dance that we're kind of doing together, and we've got to choreograph it to make the difference for Rhode Islanders.
One other quick question, if I hear talk about we should set a goal of eliminating homelessness, and that rings true. That how can you be against that?
Right.
But given Wendy, it's Wendy, right, who spoke with us? Is that yes? Given your very compelling presentation, it seems as though there are times in a person's life when unpredictable things happen and you're put on the street because of a fire or something like that. So that says to me we should try to get as close to zero as possible, but we're always going to need some kind of emergency shelter option for people. And therefore we're never going to have a time when there's zero people homeless.
Yeah,
I would love it if there were, but I want to be realistic.
we're always going to need some type of shelter, very short term, as long as there's enough housing. But even then, if there's enough housing units, the shelter beds may not be utilized as much as
Sure.
we think they will, because we can get them directly into
Of course,
housing.
right.
The question on people living outside, I have seen in my personal experience at least 2 that were living outside, liked living outside, that got moved into permanent supportive housing. It took time and patience. They were inside for a couple of days, outside for a couple of days, inside for a couple of days, outside for a couple of days, even in the wintertime. 4 years now, I know at least 2 that are inside all the time now.
Great.
So it can work.
Yeah.
It's just a lot of help, a lot of support, and a lot of patience.
Thank you.
And one thing I'll just add, when we talk about ending homelessness, we talk a lot about functional zero. So that's the idea
Okay.
that when someone experiences homelessness, it's rare, brief, and non-recurring, so that we quickly get them into something else. So
Yeah.
no, I'm not a magician that can make nothing bad magically happen to
Right.
anyone ever.
Right.
But the idea there is there's a safety net, and you're quickly kind of bouncing back. So the
That's-
goal is that functional zero.
That sounds terrific. Yeah, thank you.
Yes, Secretary.
Thank you, Madam Chair, and thank you in general, Chair Speakman, for this forum. And Caitlin, as always, really appreciate your insights. And Wendy, terrific, challenging, terrific testimony. Thank you. Caitlin, in the section of your presentation on demographics, very helpful diagnosis and articulation of who experiences homelessness. In this particular case, it's a snapshot, and you include age, race, ethnicity. Thank you for that. Do you have these data tracked over time? And I don't expect you to cite them instantaneously, but what I'm wondering is, Caitlin, do some trends stand out? Are we seeing increases in particular communities and in certain ways?
Yep. So the demographic data is over a 12-month period, and it's honestly stayed pretty consistent. We will see trends of, in recent years since COVID, more children under 5 presenting into homelessness. We've also kind of that 30% unsheltered or in shelter of Black families outside or in shelter, that stayed pretty consistent. The Hispanic numbers have actually gone up. So yeah, those unfortunately haven't really budged much. They've stayed pretty consistent. So we're seeing the same disparities over time. And we continue to see kind of the age bell curve with individuals passing sooner. We continue to see that as well.
Thank you.
Other questions? Yes, please, Courtney.
Caitlin, you know, I think the world of you guys and what you're doing, and I appreciate the breakdown of data. I think one of the things that's really important just to note is there's abundance of data in our community of which is, you know, scrupulously, you know, thought about and done and monitored, and the quality of it is something that I have not seen in other states. So I just want to commend you guys for everything that you do. But I do want to talk about kind of a comparison from state to surrounding states. You know, when you have the breakdown of this data, how does it compare against our neighbors or other communities around us?
Yeah, so my experience is we have a higher number of chronically homeless, really high vulnerable. So that's something I've not seen those numbers in other communities. It's a little hard to compare with certain neighboring states just because they're so kind of large. I like to compare us a lot with Delaware because it's kind of a similarly sized state. But one thing I'll highlight, you know, there have been dramatic investments in Connecticut and Massachusetts for housing shelter. I think they've really paid off. One difference in Massachusetts is their right to shelter for families. So right now, if we don't have, you know, I said it's like running a 911 without enough, you know, ambulances or fire trucks. We put people on a wait list for families waiting for shelter and living outside or whatever it is because we don't have enough. In Massachusetts, there's a couple of exceptions where you get sanctioned out of the program, but if you have minor children, you were able to go into shelter. So there's not that wait a month for the fire truck to get to your fire scenario. And then, I think that certainly the number and the scale is larger because they're larger communities. You'll also see a more municipal involvement in those as well, particularly Boston metro area. And then obviously Vermont, New Hampshire, Maine, you're dealing with much more rural homelessness, but also more affordability in some of the areas. So, we used to be affordable, right? We were cheaper than Boston and Connecticut, but I don't think many people feel that way anymore. So we're really, in my opinion, becoming an extension of the Boston metro area, and we have the rents to prove it, but not the income yet.
Yeah, I think the other thing that's just reinforced by the numbers that I saw today, and I have seen through you all, is the importance of knowing that this is an important part of the overall system. That we can keep, being reactive to the needs, and we should, but we also need to be focused on what does the future state look like. And I want to give an example for this group to help provide some frame. And Milwaukee has identified an opportunity. They have come together with their county officials, state officials, local officials, their United Way, et cetera, and said, we want to eradicate family homelessness by the end of 2024. They put their investments together, they put their people together, they have one goal, all striving to it, and they believe, based on their numbers, they will eradicate family homelessness by the end of 2023 instead of the end of 2024. And so really looking at what models and systems can be brought in for us to think about this differently. I agree that there will always be a need for us to provide services for folks who are experiencing homelessness. The hope is that it's a temporary solution, not a permanent one. And seeing that increase in number of folks who are staying in shelters longer than average or longer than historically shown shows us that the system is going the opposite direction. So, thank you.
Thank you. I should have known better than to schedule 2 agenda items when we have such an essential topic, and with this commission.
I do try to be fast, I'm sorry.
It is, but we have to fully explore everybody's perspective and questions on this. So I'll handle that issue later, and Jen has a question.
I can hold my question if you want to move on.
To the next agenda item? No, we want to finish with this topic first. It's not, we can't finish with it, but we have to end, we have to fully air the discussion here.
Thank
So
you, I
please
appreciate
proceed.
that. Thank
Yep.
you. So the opening of the Cranston Street Armory as a 24-hour warming center, I'm just curious if there's been any data to demonstrate that the individuals who have been coming to the warming center were unhoused on the street versus maybe living in a congregate shelter and have moved from a congregate setting into the Cranston Street Armory. Are you able to, my hypothesis is that it's a combination of the two, that it isn't exclusively individuals who were living on the street or in accommodations unfit for human habitation and are now living in the Cranston Street Armory. It's a combination. But I'm just curious if you have any kind of a nuanced understanding of how the bringing that aboard helped address shelter wait lists and unhoused situations.
Yeah, so first I just want to say a big thank you to Amos House for operating that program and certainly the state for funding it. I think I want to remind everyone that it's a warming station and not a shelter, so it's a slightly different definition. I don't off the top of my head have statistics about the entry points, although I believe because it is an HMIS that would be something we could track, where people are coming from, so I could check in with Eileen and the database team about, could we share that? Yeah, Margot's going to write a note for me, thank you. But, I will say we did see a decrease in unsheltered homelessness, right? So when we look at kind of December, November, even October, we were closer around to 400, 500, and we're down more to 375. Now that could be people going to shelters throughout the state, but there continues to be a really, really high number of people there, far exceeding what the original space was intended for. So it's clearly showing a need. Where people are necessarily coming from would be something I'd have to look into.
Yes, Vice Chair.
Thank you. Thank you so much for presenting today. And I had a question on some of the recommendations that you have to address this crisis. You mentioned the reconvening of the Interagency Council on Homelessness. Can you talk a little bit about what that was, why it might have been decommissioned, and what benefits it would bring to the state of Rhode Island? Thank you.
Yeah, and first I'll just say quickly what an Interagency Council of Homelessness is. We have one at the federal level, a USICH, United States Interagency Council on Homelessness. At a federal level, the model is that each of the state departments are together on this commission with the sole goal of making, homelessness rare, brief, and non-reoccurring. So they have an annual plan that they're all working towards. So that's where the VA might say, okay, we're going to highlight more resources for unsheltered veterans. HUD's going to line up and bring in this service piece. So it's basically bringing the federal government together to address homelessness. So a lot of cities, towns, and states have had similar success with interagency councils on homelessness. We have had it exist at least once in the past. I think it was under Chafee. I'm trying to remember going back if that was my governor chronology is accurate. I think it was enacted by the governor for about a year, 2 years. Many of you know Michelle Brophy through the United Way was actually staff to that back in the day. So it really was a regular convening of state department heads with a shared goal to address the issue. And just like HUD, our U.S. Department of Housing and Urban Development, can't end homelessness, the Department of Housing can't do it either. Like, it's all of us coming together, and even private sector, if we're going to build housing, we need neighbors that are saying, hey, let's build this here, and we're all coming together. So I appreciate the Interagency Council because it provides that direction, collaboration. It also, more and more, we're seeing the partnership with healthcare agencies and the healthcare industry to be really valuable. In Rhode Island now, you can bill for certain types of services for home stabilization through Medicaid. So that's a way to almost double the amount of money that's coming into the state if we're, instead of using grant money, billing Medicaid or utilizing other resources that can go through an entitlement program, we can house and help more people. So there's a lot that can be done with EOHHS. Even the governor has a medical respite program for people experiencing homelessness through EOHHS. That is another example of where homelessness and the medical community can come together. I can envision, dream board up the same types of partnerships with really any of the state departments, labor, training, commerce, any of them, but it's about bringing people together. Also, sharing data is really important. We do have the ecosystem in the state that the HMIS participates in. We're able to do data sharing, but, I remember meeting with state departments in previous years, like, oh, but this is how many people overlap, and that being really meaningful, and people not always necessarily understanding where the intersection between their work and our work is, and how housing will really make everybody else's jobs easier, because you're able to do better in school, earn a better living, keep your health up if you have housing.
Thank you so much.
Yep.
Other questions from commissioners? So does the coalition have a list of legislative asks or budgetary asks for this year?
We're going to just move this over to my deputy director.
We sure do, and I'm happy to talk with anybody. I'm happy to talk with anybody offline about this as well. But what we did this year is we did a survey of the service providers in Rhode Island and asked what their strengths, weaknesses, opportunities, and threats were in the communities that they're serving, and asked for their ideas for legislation. And so the ideas that percolated were around 4 themes. The first one is to create more affordable housing and remove barriers to accessing housing. The second is to protect people who are experiencing homelessness. The third is to help keep people safely housed. And then the fourth is to prevent unjust practices that lead to homelessness. So our list of legislation for this year is rental application fees. We've to do away with rental application fees. We've seen that as a barrier to many people who are applying for apartments, and this has become a very predatory practice in our state. A lot of outside or out-of-state corporate landlords are charging application fees for apartments that they don't even have available, so they're just raking in the dollars of these application fees, and people aren't even getting a chance to see the apartment. So we believe that this is a practice that's new and not needed, and we'd like to do away with rental application fees. We have another piece on fair chance housing that we're working with the Lieutenant Governor's office on. This bill was introduced last year, but we're trying to rework the language a little bit so it's a little bit more straightforward. And this is modeled after Providence Housing Authority's policy that has been working extremely well. And so what it would do is it would create a shorter look back time for people's records when they're applying for housing. They would have the right to appeal, and it limits the charges that would count to deny an application for housing. Another piece of legislation is something called Code Red and Code Blue. Code Red and Code Blue pretty much gives parameters around when there's a state of emergency for heat or freezing. And this is modeled after a New Jersey law. So and what it also does is we're trying to give RIEMA some direction on how their federal dollars are invested in cities and towns. So for instance, if funding goes to a town for a warming center, that warming center needs to be open 24/7 because we know that the coldest time is at night. And that is not the case right now. If you look at the RIEMA website, it lists places such as police department waiting areas or libraries, which are not accessible. They're not available 24 hours, and they're not trauma informed. So that is our Code Red, Code Blue legislation. We're also supporting the creation of a housing problem-solving fund. So the housing problem-solving fund would be, we're asking for $5 million in the state's budget. Housing problem-solving funds are very different from emergency rental assistance. Both are needed. We have another piece that we're supporting that's a right to counsel for evictions. We have a lot of evictions happening in the state that are unjust and are contributing to the issues that we see around homelessness. We're working on payday lending reform. Payday lending is a very predatory practice at 260% APR, where it targets lower income people of color to get into predatory loans that then take over your entire financial well-being and causes a lot of people to become homeless. We're looking at a fair notice law. So fair notice would mean that if a landlord proposes any increase in rent, that they would have to give 120 days notice to their tenant. So this, again, is something that's happening where landlords are only giving 30 days notice to increase rent, sometimes by hundreds and hundreds of dollars. And in Rhode Island, with the tight rental market that we have right now, it's causing it so that a lot of people cannot find appropriate housing within that 30 days.
We can share this list out too. Margot can email it out.
Thank you for sharing that. Appreciate that. Any other questions for our presenters? Thank you very much for this, and thank you, Wendy, for joining us as well. It's a very compelling story. Really appreciate it.